Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just joining us, we are talking about reflexes and the funny bone. That's not really a bone. We did get a couple of questions from our viewers on this topic, Doc, so we wanted to ask you, which reflexes can we control more than others? And you kind of talked a little bit about the mind earlier.
Yeah, so we can use our conscious mind to eliminate reflexes for a period of time. And one that might be useful for people to know about is the gag reflex, because oftentimes people will complain that their children won't swallow pills because, you know, they'll gag, or medication, they'll gag on that. So it's good to know that if you make the medicine or the substance very cold, it's less likely to cause a gag reflex. And also, if you ask the person, if they're old enough to do this, you can ask the child to breathe through your nose, or sometimes even if you plug the nose. And just by doing that, you're taking the attention away from the back of the throat, and the child might be able to swallow. Another trick for doing that is asking them to pant like a puppy so that they don't gag. That's something you can learn. As far as controlling other reflexes, generally they're not anything that you would need to control, except again maybe the blink reflex if you're having a procedure done and so on. But most of the time, if you use your conscious mind, you can eliminate the reflex.
Okay. The next question asks, if I'm having pain and tingling in my pinky and ring fingers, can this be tied to my funny bone?
Yes, well, to the ulnar nerve, like we talked about. It's called the ulnar nerve. It travels from your brain through your spinal cord, all the way down your arm, all the way down to your baby pinky, and it controls the strength of your grip, and it also controls these two fingers over here. So if it's trapped here at the elbow, sometimes it's because people have been leaning a lot, or they bumped their bone, their actual elbow, so many times that there's been some damage there, and there's nerve entrapment. And then a procedure can be done where that nerve is released, and then the numbness and tingling will go away.
Wow. Okay. What is reflexology, and is it healthy?
Reflexology is a completely different field. It's an alternative medicine field where it's felt that there are certain points, particularly in the feet and so on, where if they're massaged, then there will be an effect someplace in your body. This is an alternative or complementary healing technique. It isn't part of Western medicine. It's a little bit hard to study because it's hard to compare. You know, how do you know if you press here or press a little bit further up? But many people get benefit.
Okay. What is the difference between unconditioned reflexes and conditioned reflexes?
Okay. So the unconditioned reflex is just the one that you're born with as a baby. You put your finger here, you're going to grip it. You have no say in the matter. It's going to happen. And some of the other ones we've been talking about. There are so many reflexes, but the conditioned reflexes are the ones that we develop over our lifetime. So, for example, a child that is you know, let's say in an abusive situation where they know that a person's going to come up to them and they're going to get injured or hurt, they will learn to cringe, right? That's something that is a conditioned response. And it becomes something that the person doesn't even think about anymore. They don't even realize that they're doing that. When that person's abuser drops by, they cringe, or they shrink away. Other conditioned reflexes might be the driving thing that we talked about earlier, where you learn to put your foot on the brake without thinking. It's already happened before you even have a chance to realize that you're almost crashing. You've already put the brake on. So these are conditioned responses that you've done because you've practiced them over and over, again in response to a stimuli, but initially they were conscious. Initially you made a decision about how you were going to move your body, and then it became a habit that became so easy for you, so natural that that you don't have to think about it.
Just like habits then.
A habit.
Okay, good to know. What does it mean if I have no reflex in my knee?
Okay. It might mean that you've had a surgery or on your knee area, or that you've had some nerve damage in the lower half of in your lower extremities, in the thigh or in the leg. Other times people just have absent reflexes. Occasionally people are just born without reflexes. Something that happens in diabetes, for example, is also that the reflexes will be impaired. So when we check it, we'll find that they're not responding because of nerve damage from the diabetes. And other neurological diseases, for example, Parkinson's or a stroke, can impair your reflexes. And you can also develop some new reflexes that you get. For example, when there's a stroke, Sometimes a person may go back to some of those infant or neonatal reflexes that they had, the sucking reflex, the rooting reflex. For example, a stroke victim, when you touch their cheek, they will move their head and possibly try to suck on your finger on the object that you're touching their cheek with. So some of those reflexes can come back if a stroke has occurred.
Oh, wow. So it's like reverting back to
reverting
when they were a
back.
baby.
Mhm.
Okay, and our last question asks, are there any exercises I can do to improve my reflexes?
To improve your reaction and response time, definitely. To change or to affect your actual reflexes that we're talking about, the inborn ones, you can't really do a whole lot about those. But you can improve your response times, your reaction time to things by practicing. So that's how the tennis players get great, that's how the golfers get great, because they keep practicing.
Yep, my mom always told me practice makes perfect.
It does.
All right, any last words of wisdom on the topic of reflexes or the funny bone that you'd like to add?
Well, I think just if you have any unusual symptoms, for example, numbness or tingling in your fingers, get them checked out. That's something easy for the doctor to advise you upon.
All right, Doc, thank you so much for coming in as
Sure.
always, and we want to wish you, your family, as well as your staff at ExpressCare a very, very Merry Christmas.
Thank you, and the same to all of you, and thank you for watching.
Yes. Now, as we talk about the New Year's resolutions next week, how to keep them, how to make them, Doc will be back to join us for that. Send us your questions at healthyliving@kuam.com.